Liu Qi, external pathogen. In traditional Chinese medicine, the effects of climate changes and living environments on the body are highly emphasized. It is believed that diseases arise from the relationship between the natural world and humans within the context of nature's changes. Rather than attributing illnesses to specifically harmful miasmas, microorganisms, substances, or parasites, it is considered that diseases occur due to the imbalance and disharmony between external influences and human dynamics. This is a very unique perspective. The 6 kinds of energies found in nature are referred to as Liu Qi. These 6 energies are wind, cold, summer heat, dampness, dryness, and fire. When these 6 energies negatively affect the human body and cause diseases, they are called Liu Yin. For instance, if one cannot cope with the heat and falls ill because of it, for that person, the heat becomes Liu Yin. However, for others, it remains Liu Qi. Therefore, Liu Qi and Liu Yin are not fundamentally different. This concept parallels the modern medical understanding of the host-pathogen relationship. Liu Qi are normal climatic elements of the 4 seasons and the essence of Liu Yin. Liu Yin arises from abnormal climatic changes, such as excessive or insufficient conditions, representing the same entity in different states.
Disease is one of several possible outcomes of an interaction between a host and a microbe. It sounds obvious, spelled out in this way, but the issue here is more than just semantics. The use of the term pathogen sustains an unhelpful focus among researchers and clinicians on microbes that could be hindering the discovery of treatments. In the current Ebola epidemic in West Africa, for instance, much attention has been focused on the ill and the dead, even though crucial clues to curbing the outbreak may be found in those who remain healthy despite being exposed to the virus. Instead of focusing on what microbes do or do not do, researchers should ask whether an interaction between a host and a microbe damages the host, and if so, how. This approach will require different tools and potentially more alliances between microbiologists and immunologists. What is needed is the simultaneous analysis of microbial and host variables using new analytical tools. Damage to the host is a measurable parameter that can result from the microbe, the host's response, or both, and as such, it shifts the focus onto the host-microbe interaction.
When the body is weakened by an imbalance of yin and yang, a climatic phenomenon can be said to invade the body and become a pernicious influence. It is also a statement that the microcosm is affected directly by the macrocosm. When there is such an incursion, the Chinese believe that the body undergoes a conflict between the external influence and the normal qi. The first encounter of the invading influence is with the body's protective qi. If the protective qi is strong, the influence is expelled and the individual recovers. But if the qi is weak or the evil qi is very strong, the illness develops and goes deeper, becoming more involved with the internal organs. Fire. The terms heat and fire can be used interchangeably, although heat usually connotes an external evil qi and fire an internal evil qi. Fire, however, is also a normal characteristic of the body. It is the body's yang aspect, as opposed to the yin, one of the 2 bodily principles that must be kept in balance. The fire that is the normal yang of the body should not be confused with fire evil qi. The difference is a matter of proportion or location in the human landscape. Heat or fire, because of its characteristic of being hot and active, is a yang phenomenon. Its signs within the body resemble its manifestations in nature. When heat evil qi is present, the whole body or portions of it feel hot or appear hot. The person affected by it dislikes heat and has a preference for cold. He or she will display such signs as high fever, a red face, red eyes, and dark, reddish urine. Heat can also collect in small areas of the body's surface, creating fire poison. Its symptoms are carbuncles, boils, reddish ulcers, or other skin lesions that are red, swollen, raised, and painful. Secretions and excretions related to heat or fire. Evil qi tend to be sticky and thick. and to feel hot, cough with thick yellow mucus, or stools with mucus and blood, accompanied by burning sensation in the anus. Heat or fire. Evil cheese can also dry out bodily matter and deplete the fluids. Thus, a dry tongue, unusual thirst, dry stools, or scanty urination are other possible signs of the presence of this influence. The nature of fire rises upward like a flame and belongs to yang, easily pushing out fluids or burning yin fluids, causing illness. The harmful energy of fire heat is impatient and hot, easily generating wind and moving blood. This is related to the heart, causing mental symptoms, heart palpitations, and rapid pulse. Severe symptoms of fire illness burn the internal organs and deplete fluids. Common symptoms include high fever, chest tightness, thirst, sore throat, flushed face, red eyes, and rapid pulse. Among the symptoms where qi turns into fire, in wind-heat disease, staring eyes, twitching limbs, and opisthotonus are due to wind and fire competing. Symptoms like chest tightness, flushed face, fever, profuse sweating, and thirst after exposure to heat are caused by summer heat turning into fire. In the later stages of cold damage, symptoms like a red tongue, chest tightness, sore throat, and insomnia are caused by cold turning into fire. Flames rising upward, burning, fluid consumption. Fire has the nature of rising upward, easily invading the upper parts of the body, causing headaches, bloodshot eyes, and mouth inflammation. Also, when fluids are consumed due to fire heat, symptoms like dry mouth or tongue, constipation, irritability, and boils are likely to occur. Internal fire. Fire generated inside the body is easily caused by mental stress or disruption of internal organ functions and destabilizes the mental state. Heat and wind. Heat, tritit, evil. Qi, being a yang phenomenon, induces movement, as does wind. Wind is more mobile, however, and its movement is trembling or spasmodic, sudden or abrupt. Heat, on the other hand, is said to induce reckless movement, especially of blood and heart spirit. In the blood, such movement often leads to hemorrhaging and red skin eruptions. In the heart spirit, reckless movement may be recognized by confused speech or delirium, for instance, in a patient with a high fever. External heat or fire disharmonies are marked by high fever, headache, since heat rises, swollen and sore throat, dry mouth, great thirst, desire for cold, occasional bloody sputum, skin eruptions, irritability, or delirium. There is usually a higher fever with heat than with cold, and only slight or no chills, more headaches, and fewer body aches. This is because heat tends to rise, and it obstructs the channels less than cold does. As with the other external evil qis, the onset of illness is usually sudden. Dryness and summer heat. Dryness and summer heat are two distinct evil qis, but they are much less important than wind, cold, heat, and dampness. This is because they are less frequently used as a description of the inner environment, and other influences can represent them. In clinical practice, they are even more overlooked than they are in the traditional theory. Dryness. Evil qi is a yang phenomenon. It is also closely related to heat. Dryness and heat are on a continuum, with the dry end emphasizing dehydration and the heat end emphasizing redness and hotness. Thus, dryness is accompanied by dry nostrils, lips and tongue, cracked skin, and dry stools. External dryness often interferes with the circulating and descending functions of the lungs, manifesting perhaps a dry cough with little phlegm, thirst, bleeding nose or chest pain, as well as the signs of suddenness, fever, body aches, and other symptoms characteristic of the external evil qis. External dryness pathogens is caused by receiving fire pathogens from the outside. It typically enters through the mouth and nose, with the disease starting in the lungs and defensive GI. There's a distinction between damp dryness and cool dryness. Cool dryness forms in the cooler climate of late autumn and presents symptoms such as mild headache, chills, coughing, absence of sweating, and nasal congestion. Damp dryness forms in the relatively humid and hot climate of early autumn and presents symptoms including fever, sweating, thirst, sore throat, cough and hiccups, chest pain, blood in phlegm, shortness of breath, and dry nose. 1. It damages the lungs and body fluids. The dryness pathogen that invades through the nose and mouth first attacks the lungs. The lungs are sensitive organs that prefer moisture, are weak against dryness, and easily develop symptoms such as coughing, difficulty expectorating phlegm, and asthma. Besides the lungs, symptoms of fluid consumption such as dry skin, dry hair, and constipation can also appear. 2. Internal dryness. This is likely to occur when the body's blood or fluids become deficient due to high fever, bleeding, excessive sweating, or aging phenomena.
Cold in a person as in nature is a yin phenomenon. It lacks warmth and is slow or immobile. The two most important signs indicating that the human landscape is immersed in a cold weather pattern are that the individual feels cold or seems unusually slow. The entire body or part of it may be cold to the touch or may have a pale, frigid appearance. The person can have a marked aversion to cold and seeks warmth in the form of needing to keep a room warm, wearing an extra sweater, or even using a hot water bottle. Organ functions become hypoactive. Psychologically, things seem delayed and lumbering.
Cold in the body acts as it does in nature. It contracts things, obstructing normal movement. Cold can freeze, leading to sluggishness, underactivity, and hibernation. Cold in the channel can block the circulation of qi or blood, causing severe, sharp, cramping pain that may be responsive to heat. Cold in the channels of the limbs may lead to contractions and stiffness. As the Neijing remarks, cold enters the channels and there is retardation of movement. The qi cannot penetrate. And finally, there is pain. Secretions and excretions related to cold disharmonies are clear or white, with a cold look, such as clear or white fluid. The Neijing says, cold is watery, transparent, clear, and cold. When cold pathogens are in the exterior, symptoms such as feeling cold, fever, absence of sweating, shortness of breath, body aches, and a floating and rapid pulse appear. Also, when cold pathogens invade the muscles and bones become painfully tight, and when they invade the internal organs, symptoms like vomiting, diarrhea, borborygmus, and abdominal pain occur. Cold, pain, and contraction. Cold pathogens are the most depleting to the body's yang qi, causing cold symptoms. Blood circulation worsens and pain develops. Due to cold pathogens, when joints contract, it becomes difficult to extend and flex them, and when pores are blocked, sweating stops. Internal cold. When the body lacks the strength to warm itself and cold develops internally, symptoms of coldness appear, such as cold hands, feet, or lower back, and pale urine with increased volume.
Dampness is wet, heavy, and slow. It is yin. Human activity should ceaselessly transform from one state to another. When it gets bogged down, Chinese medicine sees dampness. Dampness accumulates, has poor and unclear boundaries, and tends to be sticky. Dampness is heavy, turbid, and lingering. It has a kind of soft overstability. Dampness tends to move downward, and so the Neijing states that the lower body is the first area affected by dampness. When a person experiences dampness, the head may feel dull, as if in a sack, the Chinese say. The limbs may feel heavy and sore, and the person will express a dislike for damp environments. Excretions and secretions associated with dampness are copious and often turbid, cloudy or sticky, like sand in the eyes, cloudy urine, heavy diarrhea, heavy vaginal discharge, or fluid-filled or oozing skin eruptions. Dampness can easily obstruct the movement of qi, producing fullness of the chest or abdomen and dribbling or incomplete urination or defecation. Dampness can penetrate the meridians, affecting the limbs and causing heaviness, stiffness, or soreness of the joints.
Dampness resonates with and most easily affects the spleen. The spleen rules the raising of the pure, and transforms the valuable components of food and drink into qi and blood. This transmutation depends on a vaporization process that requires a dry environment. A traditional Chinese saying sums this up as "the spleen likes dryness." The spleen is therefore especially sensitive to dampness. Dampness can readily distress the spleen and interfere with its raising of pure foods and fluids. This can be seen in signs such as loss of appetite, indigestion, nausea, diarrhea, and abdominal edema. At the same time, however, other spleen disharmonies, because they prevent the raising or transforming of fluids, can allow extra moisture to linger in the body, leading to a condition of dampness elsewhere in the body. Dampness is a transformation of water and has mass. When dampness invades the skin's surface, it can make the body or limbs feel heavy, or cause secretions like eye discharge or leukorrhea to become dirty and turbid. Also, just as water flows from high to low places, dampness tends to invade the lower parts of the human body. External and internal dampness are distinguishable primarily by their speed of onset. External dampness will be acute and accompanied by other external signs, but will easily turn into internal dampness. And internal dampness will make a person more susceptible to external dampness. Either type of dampness lingers and stagnates, and even external dampness can last a relatively long time. When the function of the spleen weakens, fluid metabolism becomes inefficient, and dampness accumulates inside the body, internal dampness. The accumulation of fluids in the body that are not excreted is called dampness or phlegm. This constitution also tends to be susceptible to external dampness.
Wind. The nature of wind is fast and unpredictable. Therefore, in ancient times, people attributed sudden illnesses to wind. Unlike cold, heat, or dampness, wind is not intuitively connected to the human body. Symptoms like fever point to heat, sensitivity to cold indicates coldness, and swelling or diarrhea suggests dampness. However, wind does not have such direct correlations, making it a pathogenic factor that many novice acupuncturists overlook. First and foremost, acute illnesses or rapidly changing conditions can be thought of as wind-related disorders. This is one of the most clinically significant manifestations of wind. For instance, sudden lower back pain, colds, or muscle aches that progress quickly within a day or two can be classified as wind-related illnesses. A representative example is zhongfeng, or what we now call stroke. In the past, zhongfeng did not exclusively refer to strokes as defined in modern medicine. Instead, it encompassed all sudden collapses. In the West, this is referred to as stroke, a term that also conveys the idea of being struck down suddenly. The term originates from the Greek word apoplexy, which similarly describes a sudden and overwhelming attack. Secondly, wind is associated with the liver and muscles according to the 5 elements theory. Symptoms such as muscle tremors, spasms, or opisthotonos were all attributed to wind. Since wind shares the same wood element as the liver, ancient physicians believed that wind could arise not only from external factors, but also internally within the body. This internal wind was termed neifeng. Internal wind became a major pathological concept after the Yuan dynasty. At that time, physicians observed that patients who suddenly collapsed were not always exposed to external wind, prompting the need for a theoretical explanation. Thus, a theory emerged that even without exposure to external pathogenic wind, internal wind could arise if the liver, an organ associated with wind, failed to function properly. This theory remains relevant today, as conditions like hypertension, headaches, and eye diseases are often treated as internal wind. While internal wind and external wind share common manifestations, such as suddenness and collapse, they are fundamentally different in pathology and require distinct acupuncture and herbal treatments. Additionally, even colds were considered wind-related illnesses. In the past, many diseases were explained under the concepts of wind and cold, zhongfeng or shanghan. For instance, in the Shanghan Lun, zhongfeng often referred to colds and early-stage infectious symptoms. Thus, wind has historically been a critical concept in traditional East Asian medicine for explaining the causes and pathology of diseases. 1. Wind moves easily and changes readily. Wind has a nature of moving lightly upward and outward, easily invading the upper body and skin and tending to shift locations. 2. Internal wind. When liver function is impaired, wind can generate internally, causing symptoms like dizziness. Spring is a season when the autonomic nervous system is prone to disruption, related to liver wind.
The 6 pernicious influences, internal or external, can never be seen in isolation from the body. They can only be recognized by the signs and symptoms that accompany them. And those signs and symptoms are part of a human pattern that is greater than any one pernicious influence. The dampness or the wind cold that begins a disharmony is part of the disharmony itself, and the disharmony contributes to the condition of dampness or wind cold. The linear idea of cause and effect becomes a circle in Chinese medicine, because Chinese pattern thinking subsumes all the pieces into a more important whole. Dampness or wind cold or other climatic phenomena are finally descriptions of human landscapes, metaphors that relate what's going on in the body to its complement in the universe. As causes, they are secondary to the overall pattern. In fact, in some cases, exposure to dampness may generate a cold condition, or exposure to cold may generate a wind-heat condition. And if someone has been exposed to dampness but manifests a heat pattern, then heat is what counts. Treatment will be for heat, not for dampness. In biomedicine, it is often impossible to treat a condition without knowing the cause. In Chinese medicine, the treatment is always for the condition itself, regardless of the cause. The pernicious influence as a cause is unimportant.
An individual may have tendencies toward a certain state. One person is usually cold or damp, while another is hot or dry. Each of these people will receive an evil qi in his or her own way, so that it will become part of that person's unique pattern. The evil qi does not have any characteristics that belong to it alone, and that are not defined by its manifestations in a particular person. The evil qi can only influence, it cannot determine. And with all the elements that are considered in Chinese medicine, it is just one piece, another sign to be woven into the pattern.